The number of coronavirus cases in the United States has risen to close to 700,000, with nearly 37,000 deaths so far. To put that into perspective for a moment, in less than 2 months, coronavirus has taken the lives of nearly as many Americans as those killed in the Iraq, Afghanistan, and Korean wars combined. It's just staggering. And it's also killed more people so far than the flu did all of last year.
And when it comes to the most vulnerable victims, a staggering and disproportionate toll is emerging, with African Americans accounting for 1/3 of the deaths from coronavirus. That's according to an analysis from the Associated Press. And some states are beginning to announce their plans to reopen in what the government calls phase 1, with Texas now saying it's ready to ease some social distancing restrictions within the week.
Our team is covering all of it this morning, all across the country. Let's begin with NBC's Kathy Park in Times Square. Kathy, good morning to you.
Kristen, good morning to you. New York City won't be getting back to normal anytime soon. These masks are now required in public when social distancing can't be maintained. The mayor also announced that non-essential events like concerts and marathons will be canceled for the month of May. Meanwhile, in other parts of the country, they're planning on loosening restrictions for businesses starting next week.
Overnight, New York and San Francisco tightening the rules, requiring all residents to wear a face covering in public, while some parts of the country may be back in business sooner rather than later as governors look to lift orders.
Opening Texas must occur in stages. Obviously, not all businesses can open all at once on May the 1st.
Texas announces first phase will allow product pickup at retail stores and a reopening of state parks. Beaches in Jacksonville, Florida are now open for limited hours. And in Michigan, some of the strictest social distancing rules in the nation may loosen up for businesses on May 1st. This comes after protesters clogged roads in front of the state capitol, demanding they get back to work. The frustration also building in New Jersey. Let's get to work! And Oklahoma.
Why crater the economy when the virus is fortunately not as bad as what it was anticipated to be?
New York still tops the nation with the most coronavirus cases. And while the curve is bending, deaths and hospitalizations keep climbing. And more sobering news. 19 nursing homes of only 68 that responded to a state survey reported at least 20 deaths linked to the virus. The New York governor drawing the ire of the president, who tweeted Friday, Governor Cuomo should spend more time doing and less time complaining. Get out there and get the job done. Stop talking. Cuomo firing back.
First of all, if he's sitting home watching TV, maybe he should get up and go to work, right?
But amid all the uncertainty, a possible treatment. The experimental drug remdesivir appears to show a rapid recovery in COVID-19 patients.
But we do not have enough data right now to conclude that they are indeed effective. But we have a strong feeling that they are.
And more encouraging news on the front lines. 55-year-old Elber Soriano got his life back and a round of applause, becoming the 500th survivor at this Long Island hospital.
Thank you. Thank you.
And these days, the streets of New York are still pretty quiet because the stay-at-home order is still in effect. But there is a bright spot in places like Times Square. A lot of these digital displays now have messages of gratitude. And the hope is that essential workers will look up and know how much they're appreciated. Kristen, Peter?
Everyone holding on to those bright spots right now. All right, Kathy Park in New York's Times Square, thank you for that.
And after announcing the White House's 3-phase plan for states to reopen, President Trump is now saying the decision on how and when to do it is up to the nation's governors. The important question, is there enough testing capability to do it safely? NBC's Kelly O'Donnell is at the White House this morning. Kelly, nice to see you. Good morning.
Good morning, Peter. The White House Coronavirus Task Force says the testing of all Americans is not actually needed or practical. Instead, their plan looks at widespread testing of those with the highest chance of exposure, like first responders, and then targeted testing when there are spikes of illness. But some experts say much broader testing is the best way to get people back to work.
One key to reopening the country: unlocking greater access to testing. The president put the burden on governors.
Governors are responsible for testing, and I hope they're going to be able to use this tremendous amount of available capacity that we have.
With charts, graphs, and experts, the White House argued that the scrambling for coronavirus tests and related supplies raised by governors is being fixed.
We will have, and there will be enough tests to allow us to take this country safely through phase one.
We're going to work with the states, so we're going to help them.
But the president pounded 3 states with Democratic governors for their virus restrictions on Twitter Friday. Liberate, he declared, hitting Michigan, Minnesota, and Virginia.
But I think elements of what they've done are too much.
The president then praised State House protesters, many of whom did not wear masks or practice social distancing.
They seem to be very responsible people to me, but it's, they've been treated a little bit rough.
Given the scope of financial hardship, the president lashed out at Democrats, insisting Congress must replenish aid for small businesses.
Nancy Pelosi, she's away on vacation or something, and she should come back. She's not doing her job.
The administration announced a new $19 billion relief program to pay farmers and buy their products.
Mass purchases of dairy, meat, and agricultural produce to get that food to the people in need.
Eager to reboot, the president said he looks forward to someday campaigning again, but would prefer rallies without social distancing.
It loses, to me, a lot of flavor, but I hope we're going to have rallies. I think they're going to be bigger than ever.
The vice president said he'll be presenting this plan on testing to governors Monday. But in a conference call with Senate Democrats Friday, things got heated. And Maine Senator Angus King even tweeted that he was so angry, never angry that much on a phone call before, and he called the White House plan a dereliction of duty. Peter, Kristen?
Kelly O'Donnell at the White House. Kelly, thank you.
We now want to bring in Dr. Irwin Redlener. He's an NBC News public health analyst and is the director of the National Center for Disaster Preparedness at Columbia University. He's also serving on former Vice President Joe Biden's Coronavirus Advisory Committee. Dr. Redlener, good morning. Good to see you. Thank you for joining us. We do want to dive right in. Good to see you. From a public health perspective, are we ready to reopen at this point?
Well, I don't think so, Kirsten. And there's many people who have much stricter ideas about what is safe to when it'll be safe to reopen, which include a lot more testing than the government is proposing. And I am concerned, actually, that we have a long ways to go before we get there. And secondly, we do need rules for how we're going to function in the workplace, including more social separation, wearing of masks and so on, and making sure that people who are ill are not coming to work. And these things, why they're theoretically available, the fact is the president has repeatedly told us they'd be ready, they'll be ready next week, et cetera. But we still have a ways to go before we have enough testing capability to make sure that everyone is safe in the workplace.
So, Doctor, you talk about our desire to have enough testing capability. Right now, roughly 1% of Americans have had one of these tests. The White House says it's not feasible. It's not going to happen that everybody in America can get a test for this. So how many people would need to be tested for it to be safe for them to feel comfortable going back to their lives?
Well, first of all, totally, we should be testing at least 1.5 million to 2.5 million people every week, and we're far behind that goal still. We may get there, and of course there's some new developments like the new Abbott Laboratories test to make sure that tests can be done at the so-called point of contact and get the results back in between 5 and 15 minutes, and that'll be a big innovation. But that test is far from available in a large-scale way around the country. So the rush to get back to work, which we understand because the economy needs to get rebooted, is confronting a really serious threat of a resurgence of COVID-19, and I don't know that we can afford that, and we don't need to be rushing it. We're trying to play catch-up with the fact that it's taken so long to get our act together with testing. We're still not quite there, and we'll see if the president's promises actually materialize, Peter.
But Dr. Redlener, there are large portions of the country where we're not seeing a widespread of the virus, where there's in fact less than 500 cases of the virus. So why shouldn't those areas get back to work and get going again?
Well, first of all, the areas that right now seem to be relatively free of the COVID virus could certainly surge. We have no idea because we don't know that much about the behavior of the virus. So you take an area that has had relatively few cases, we expect actually that many of those areas will become hotspots at some point in the future. And the other thing is it's going to be very difficult. Let's say we reopen work relatively, let's say in a minor way to begin with in a particular area. We're not going to put a moat around that area. There'll be people traveling in and out of that area, and the possibility of having some people who are infected get into the areas that we think are relatively clear is always going to be there. So there's lots of challenges here, and I would have preferred a national program of everybody shutting down for a period of time until we could say that the whole country is relatively free.
All right. Well, we are entering a critical next phase. Dr. Irwin Redlener, thank you so much. Really appreciate the information this morning.
Sure.
With unemployment rising to staggering new highs in this country, food banks nationwide are seeing record numbers, serving more people in need than ever before. In Texas on Friday, thousands of people lined up for hours to get some help. NBC's Morgan Chesky is at a food bank in Plano, Texas this morning. Morgan, good morning.
Yeah, Peter, good morning. And the folks here at the North Texas Food Bank seeing this need unlike ever before. We checked the numbers yesterday, more than 2,300 families able to get much needed meals. And you mentioned this is not just an issue here. Millions of families nationwide now coming to grips with a tragic new normal.
The images are staggering. Thousands of families lined up for a food giveaway, this one in San Antonio. Some arriving the night before to secure a spot in line.
Wow, so many people in need.
Hello. Organizers say more than 2,000 families registered, 70% of them first-time food bank visitors. Petra Baskin was furloughed from her job at an auto parts supplier.
It's embarrassing. It's the first time I've ever done this.
As tens of millions of Americans now find themselves out of work, scenes like this are playing out all across the country, in Florida, New York, and Maryland.
People don't have the money that they had a month ago, so they need to spread their dollar as far as they can get it to spread.
Back in San Antonio, organizers say they feed nearly 60,000 families in a typical week. Now, that number has doubled, prompting a new concern. Can donations keep up?
Support is coming from lots of places. I just worry that the support or the supply won't meet this demand.
This weekend would have been the start of Fiesta, San Antonio's equivalent of Mardi Gras, and a huge moneymaker for local businesses, now left fighting to survive. Pete Cortez's family has owned Mi Terra restaurant for generations, famous for its food available 24/7. Now, with employees furloughed, Pete's converted to selling groceries just to stay afloat.
I've literally worked here since I was a kid, and so to walk, have to put a chain on the door every night and walk away. It breaks my heart.
And you can hear that frustration echoed in so many people across the country. And we're already seeing the impact this pandemic is having. Since it settled in Texas, the North Texas Food Bank delivered more than 6 million pounds of food to folks who need it. Peter?
And Morgan, for each family, how much food are they able to take home after a trip to one of these food banks?
Yeah, we talked to the folks here. That depends on how big each family is, but anyone who shows up will get a box that's loaded with everything you need for a healthy breakfast, lunch, and dinner. Shelf-stable items, fruits, veggies that should at least last several days and potentially up to a week. Peter, Kristen?
All right, they're going to need a lot of help for a while, we fear. Morgan Chesky, Morgan, thanks.